Welcome to the webinar, Infection Prevention, Engaging the Staff and Partners for Better Compliance, sponsored by ImageFIRST. Our speaker today is Magali Trenier. Magali is the Director of Marketing at ImageFIRST Laundry Specialists and holds a Master's in Business Administration from the Pennsylvania State University, where she did a focus on large-scale organizational change to better understand how to effectively implement behavioral and cultural transformation through the empowering of local teams to drive change. It is now my pleasure to welcome Magali to the virtual podium.
Thank you, and welcome to today's webinar. So probably the first thing you're wondering is probably, well, wait a minute, here's obvious fact number one. You already know about HAI. What you need is for others to do their part to help infection control. Well, I'm going to cover a few things that may help you. Here's the good news. You can persuade people to change, but only with the right motivators. In this webinar, I'm going to quickly go over the latest stats on HAIs, some best practices to engage staff, patients, and visitors to better comply, discuss briefly commonly infected surfaces and how to rely on delegation to your industry partners by leveraging their innovations. So, patient satisfaction, HAIs, HCAHPS scores, everyone's talking about these lately. So here's a little bit of the latest on HAIs. About 1 in 25 U.S. hospital patients contract at least one HAI. Approximately 30% of patients in ICUs are affected by at least one HAI, which means U.S. hospitals see over 1.7 million HAIs each year, costing up to $45 billion per year. The CDC tracks 5 different HAIs that are major HAIs. Centrally lined associated bloodstream infections, which are down versus a year ago, 46%. These are the latest figures from the CDC, despite for the fact that it says 2003. For select surgical site infections, those are down 19% versus a year ago. Hospital onset MRSA is actually down 8%. Hospital onset Clostridium difficile infections are down 10%. And catheter-associated urinary tract infections were actually up a little bit, 6%. However, some initial 2014 data, which has not yet been compiled by the CDC, suggests that there is a noted decrease, which is good news. Well, so here's obvious fact number 2 of the day. HAIs are a major yet preventable threat to patient safety. Well, you already know that HAIs are associated with a variety of risk factors: indwelling medical devices, surgical procedures, injections, overuse or improper use of antibiotics, contamination of healthcare environment, and transmission of communicable diseases between patients and healthcare workers. So when we think about tracing back contamination, and we think about the contamination of healthcare environment and the transmission of disease, how does that even happen? Well, studies show that 20 to 40% of HAIs can be traced to the contamination of healthcare workers' hands. A recent article correlated the most frequently touched parts of hospital rooms and the degree of MRSA contamination. And what they found is that the most touched and most contaminated items were bed linen, patient gowns, bed rails, and overbed tables. Whereas less touched, of course, was less contaminated, which was sink, furniture, flat surfaces, and so forth. So when we think about tracing back contamination, here's an example. Cubicle curtains. They're actually a potential site of bacterial contamination. In a longitudinal study that assessed the prevalence of bacteria contamination on privacy curtains, found that 92% of curtains showed infection within 1 week. And 95% of all curtains demonstrated contamination on at least one occasion. So they measured multiple time points and found that there were different types of VREs, which basically suggest frequent recontamination. So, obvious fact of the day number 3, proper hand washing helps minimize infection. Wow, there's a groundbreaking idea. This hot topic should really be a done deal for any developed country. So where are we today in the U.S.? Well, Leapfrog just published their latest in hand washing, just in June of this year. And in this study, some good and some bad, 99% of reporting hospitals achieved hospital-wide education and training to prevent HAIs related to inadequate hand hygiene. So that's great. 87% of hospitals hold patient safety officers accountable for improving hand hygiene, and they do that through performance reviews or compensation, even though most hospital reported still struggling with that piece. And there has been visible improvement since 2013, so that's the good of the report. However, 1 in 4 hospitals still need to improve hand hygiene practices. Levels of adoption of hand hygiene really vary greatly, significantly, state by state. And urban hospitals still outperform rural ones, which isn't surprising. So we're not quite there yet. But that's not all. There are more HAI-related deaths annually in the U.S. than there are car accidents. On average, adults come into contact to well over 840,000 germs daily. Only 1 in 3 adults wash their hands after sneezing. A surprising 7% of women and 15% of men do not wash their hands at all after using the restroom. More than 50% of us do not wash our hands after riding public transport, handing money, or using shared exercise equipment. And most shocking of all, only 5% of Americans wash their hands properly. But we know that proper hand hygiene and use of alcohol-based hand rubs can reduce infection rate by as much as 40%. So that leads me to obvious fact number 4 of the day. I educated the heck out of my staff, and they still don't change their behavior. Well, change is always the thing everyone wants, as long as they're not the ones to do it. And yet people do change, generally for one or multiple of 3 reasons. The first is they know why they're changing. By the way, people retain barely 10% of what they're exposed to daily. But they will change their behavior if they see the new behavior as easy, rewarding, and normal, which goes back to education. If they're held accountable, people will change if they are accountable to others. This is about providing visibility. And finally, people will make change to avoid getting hurt again if they got hurt. But let's try to avoid this one. But short of embarrassing people into compliance, wouldn't it be great if it were that easy? How should you go about it? Let's face it, your challenge is persuading others to change their behavior. Well, there are basically 2 kinds of change, evolutionary change and disruptive change. And just like their name suggests, evolutionary change is gentle and less destructive, but it takes a very long time. Disruptive change is fast and sometimes necessary, but very disruptive, obviously, and can be extremely destructive. People are very clever, though. They figured out a way to speed up evolutionary change. Think of selective breeding programs, for example. And also, we've figured out how to contain disruptive change. Think about how we've managed forest fires, for example. Many change efforts are done according to the disruptive model. You've often heard, let's shake things up around here. And that's why they don't work. This is why coming up with a strategy of how you can get an evolutionary change into your environment is so important. And your first step really starts with having leadership support, as well as identifying locker room leaders. There are a lot of studies around large-scale organizational change of how to implement changes in large groups. And the importance of these locker room leaders, of these sub-teams, cross-functional, are really the key to either a failure or success in change management. Having the right strategy in place, obviously, is very important. And it really starts with conducting a gap analysis. So observing prevalent existing behaviors in your hospital and comparing how people would act in an ideal state will identify the gaps for your particular hospital. And then selecting the right tactics. So again, think evolutionary change versus disruptive, and focusing on a few key changes rather than trying to improve everything at once will give you more chances of success, especially if you leverage those locker room leaders. So then you can prioritize behaviors and tactics that have the greatest impact, and choose ones ideally that are widely visible and most likely to be emulated. And then, of course, developing an annual plan. And in this plan, as you're thinking about executing it, it's ensuring that these locker room leaders that are cross-functional are working with you and fully engaged into it. Because ultimately, after you have these 4 steps in check, everything is about executing. And the only way you can measure success is if you monitor and track. So remember, you have to be relentless with repetitive education for staff, patient, and visitors. And yes, you are going to have to accept that this will never be a completed task. So again, if you think about multiple tactics, it will give you more chances of being successful. As I mentioned before, you really want to start at the top, which is your key player support. That starts with management, but it's also administrative support, and again, the identification and full support of your locker room leaders. Then it's about ensuring that you can provide the following. Potentially improved environment. Maybe you need to increase availability of water and soap and or alcohol-based hand rubs. Or maybe you need to look into automation. For example, nowadays you can find automated sinks that are powered by just a light, and they count down the number of seconds as you're hand washing, thus helping your staff being a little bit more disciplined. And then the educational piece will be just never ending. It has to be something that continues to live, whether it's lectures, training, papers, top-of-mind reminders like signs and verbal reminders and posters to ensure that your staff stays on top of everything. And finally, the cherry on top is really having visible individual and collective goals with periodic checks of progress. So both, ideally, you can have your staff make public commitments. Now, that doesn't mean public commitments, posting it on the walls for patients to see, but it could mean public commitments within the department so that we hold each other accountable, as well as looking into audits of hand hygiene and performance feedback. So here's an example of how you could do a gap analysis. So as you're assessing where you want to spend your time, this particular spreadsheet, would be a lot longer if you were to do it. This is obviously to make it legible for you. On the left-hand side, you would put the types of things that would be beneficial for infection prevention, whether you've observed them, and ideally you would run this assessment over several weeks with the help of your locker room leaders. If it's not observed, obviously it gives you a gap, and then you can look at how impactful that particular tactic is and whether or not it's visible to others. So in this example that I have here, I basically took a list of things and said, okay, well, how easy are the restrooms to find? Do we have alcohol-based hand wash available? Or is there visible and easy to understand signage? And then have you observed proper hand washing, whether it's staff, patients, or visitors, because the tactics will be different for any of the 3? Do you see those 3 groups using alcohol-based and so forth? And what I did in this particular example is anything that's a no becomes your gap. And then you can gauge rough impact and visibility. So if I take again, is it accessible? Are the restrooms accessible and easy to find? Well, obviously we know that water and soap is the most effective way to rid yourself of potential infection. So that's a very high impact. However, it may not be visible to others because if I'm going to the restrooms, there may not be anyone in there that observes whether or not I hand wash properly. But an alcohol-based hand wash, which is out for everyone to see, we know is less effective than soap and water, but it will be more visible because more people will see whether or not you're using it. And so you can create a spreadsheet like this basically to assess what your hospital is going to need. And then you really move into implementation. So again, assuming at this point you've identified your cross-functional team that's going to help implement these changes. You've already used your locker room team to assess behaviors. You present your results to get leadership and staff buy-in and support. You can then set overall goals for the hospital. Develop and deploy a calendar of efforts, and this is when, again, your locker room team, which ideally is cross-functional, is going to help implement these changes within their areas. Ensure managers set individual and department goals. So it's great to have an overall goal. Again, I would not recommend having a lot of them, but even if it's a basic one or two overall goals, then each manager can set maybe one or two individuals or one or two department goals, and it gives you a very tight way to hopefully be more successful because you'll have less but more specific goals. And finally, tracking attendance so that things like trainings and events, you can gauge whether or not the associates are attending. So in the example I threw together on the right-hand side, if you said that your gap analysis are the items on the left of the chart, then you can start putting a plan together January through December. Let's assume your fiscal year starts in January. Then you have the first 4 that you start. Maybe your periodic checks of progress are monthly that you can report back to management and so forth. And basically, you end up having a visible roadmap of the progress that you're making. Which leads me to obvious fact number 5. Managing commonly infected surfaces is no small task. When we think about commonly infected surfaces, there are really just 2 types, hard and soft surfaces. And the way you deal with them, which, as you know, are very different, because hard surfaces, you can use things like wipes and like antibacterial wipes, and they're very effective, but those types of solutions do not work for soft surfaces. So for hard surfaces like floors, they can easily be maintained with mops that use washable microfiber pads. The reason I'm recommending that one specifically is because microfiber pads will have a better ability of picking up all the dirt, and if they're washable, then you can use your best practices for laundry and ensure that they're completely free of any potential infectious material. And I'll touch on best practices of laundry in a little bit. Obviously, hard surfaces like the bed rail and side tables that I mentioned earlier can be treated with one of the many antibacterial wipes or products available on the market today. And soft surfaces like wearables of scrubs, patient gowns, and bed linen, those are a little tougher because they really have to be sanitized and disinfected. And the solutions out there for hard surfaces like sprays and wipes just don't work on soft surfaces in the same way. And this actually leads me to healthcare laundry best practices. And the thing I would urge you to do, and I know this is probably going to seem like an obvious slide, but you'd be surprised how many people don't think about every step of laundry and linen and the potential areas where they can get infected. So your washing better be effective at disinfecting and sanitizing your linen for the next patient. And it seems like an obvious one, but not all laundry is created equal. And certainly home laundry or self-laundry can be insufficient at killing all of bacteria if the improper things are used for it. Some hospitals will let their staff take their scrubs home for washing, but that's problematic because the detergent they're using may not be good at really disinfecting and sanitizing the linen, or you risk potential allergens. The second area to think about is whatever happens as soon as the linen leaves the wash cycle. Because the second you pull the linen out of your wash, it risks infection, whether it's airborne pathogens or handling. So you really have to think of how can you protect the linen as soon as it's cleaned. Thirdly, you really have to think about storage. So storage can be a couple things, whether it's at your site, in your laundry room, or at your laundry service provider. If it's not properly handled, it will risk infection. Staff handling, well, I already covered hand washing, didn't I? Whether it's your own staff or your laundry service provider staff, unless the U.S. has a compliance of 100% for effective hand washing, it's a risk. But I believe the number I gave you earlier was 5%. Yep, 5% of U.S. adults who wash their hands effectively. Yikes. And finally, once you have a case, you have to know that the linen has the best chance of being infection-free once the patient gets that gown. So, if I were to take you top line, healthcare laundry practices, really it's about having the proper washing process and ensuring that it's effective and compliant, obviously. Avoid risk of infection when it's in storage. So from the time it's washed to when it's getting to a patient, you can prevent potential reinfection post-wash with treatment to isolate and inhibit growth of any bacteria. So there are things like bacteriostats that can do that as long as you have it as part of your cycle. And then ensuring that your linen is encased in plastic wrap, which will really help prevent reinfection. And if you're thinking, wow, it's a lot of pieces I have to worry about, then guess what? That's going to take me to obvious fact number 6, which is, wait a minute, I can delegate this work. That's right, you can. Fortune 50 healthcare companies are today looking for true partners, not vendors. And those Fortune 50, by the way, they end up on that list because they're best places to work. And they believe in that because the right partner will do the work for you and alleviate not only your workload, but your staff's workload as well. The right partner will also bring you innovative solutions because they're the ones ensuring that they want to provide you the best service. So a good example of that is what we do at ImageFIRST. We have something that we call triple bioshield protection. And what that is first of all, in the washing process, we believe dead on contact. So we want to sanitize and kill 99.999% of common pathogens. The second thing is we do something called Backstat Bioshield, which is a protective EPA-registered coating and softener, which creates an inhibition zone for bacteria, which means basically if the linen is infected, this coating will prevent the bacteria from spreading and growing. And finally, a plastic barrier. So all of our products are encased in plastic barriers, and our patient gowns are actually individually packed after they're hand inspected. And finally, we actually use an independent laboratory testing to ensure that our cleaning processes comply with and exceed government standards. So what about those privacy curtains that I mentioned earlier? Well, regular disinfecting is really the only way to prevent infection, obviously. But this is another one where you can let your industry partner handle the cost of managing and changing and cleaning an inventory of cubicle curtains. So as an example of that, ImageFIRST actually has a cubicle curtain program that's pretty turnkey, where essentially the hospital selects the curtain with the colors and patterns that match the look they're going for, and then we'll take the measurements, we'll place the order, and we'll do all the installations. And from that point on, we're the ones who do the work. So we will schedule the replacement, where we will come in, remove, and replace the curtains. And then we will also document, which is that we'll scan to document that particular curtain having been changed out so that you get infection prevention reporting. And then the removed curtains are cleaned, sanitized, and inspected for quality. So you can see here an example of what our team does, which is taking down very quickly the bottom part to be able to clean it. So what's great about this program is that it's improved safety for patients and staff. It gives you documented infection prevention compliance. It's also minimized disruption for patient and staff because the mesh part at the top stays on. The bottom is what gets removed and cleaned, and there's no need for a ladder, so it can get done very quickly. There's no upfront cost for a hospital. It's very cost effective because the staff is now freed up not having to manage it, but at the same time you know that you have infection control in your curtains, and anything that's stained or ripped, we actually replace at no cost to the hospital. And we actually have a process in place for fast isolation discharge. And finally, this program is also simplified where the curtains themselves, the bottom part that you change, is always the same in size. So from an inventory management, it's great. And you don't have to manage permanently stained or ripped curtains because we take care of that. It's compliant and consistent, has a consistent height off the floor. Very efficient for staff. So if your staff has an isolation case and needs to change the curtain in between visits, the curtain can be changed with no ladder and within 90 seconds, which means, one, if you don't even have to get a ladder out, you don't have to worry about anybody getting potentially injured. And two, 90 seconds, which is the least amount of disruption you can hope for. And finally, the mesh at the top, which doesn't get changed out because it doesn't get touched, actually is antimicrobial. So to recap today, in this webinar, we covered a little bit of a top overview of HAIs, how they're avoidable, but yet there's still some work to be done. Some best practices of adoption, we know that people will only change if they're probably trained and held accountable. But also, remember, be relentless with repetitive training and hold the staff accountable. This is not going to be one and done. It has to be an ongoing thing that happens. Don't forget to delegate to the right partners to take care of your commonly infected areas. After all, that's what they're for, is to help you and to help free you up. And you can also rely on them for innovative services to help you with infection prevention. In closing, I just wanted to thank you for your time today. If you're interested in any of the materials I showed today, such as the growth stats of hand washing, the gap analysis, and so forth, don't hesitate to reach out to me. The CDC has a lot of wonderful resources available, but they're not always visual enough for most people who are not as well-versed as you are. Thank you.
Thank you, Magali, for this very informative presentation, and this concludes today's webinar.